Hi, di. Grabe, di kasakit. Kay, kuan man, I just got home from the interview, di. Tapos, it's 7:55 na. Yan, yato ko dito around 7. So, it's nag-start may mga 7:15, 7:20, 7:10, ana. So, pila ra ka minutes ang interview. Diba, katurang yanto na ako sa eskwelahan. Di niya, kabaw ka di, nag-heels biya ako, di. Like, sakit kay siya, di. Wait lang kay Saba. Gabaklay ramanggod ko paingon sa school kay tuo ko comfortable ra siya, comfortable man siya sa balay. Paglakaw na ko di na siya comfortable, di wa pa ko kabot sa eskwela, wa pa ko kabot sa hospital, di kasakit na akong tiil. Imagine. Pero wala, ano tayo, it is ganda, di ba? Aesthetic kay tadi mura tag K-pop nga, ay nayo ay. Wala pa jud ko nakatake og mga pictures kay kaulion na jud ko, di kay sakit jud sa kaayo, di nice man mag heels, di like angayan siguro ko, pero kay taasod man ko og legs, pero di kay sakit man siya, bi we're not gonna work. Sabi na ako maapdan kog half day, ako may una gi-interview kay ako may una naabot, so yun, it went smoothly man na ako'y audio, di ako lang i-insert dire inig after ani. Pero until now sakit pagyapon akong tiil. It's namamaga, what do you call that? Wala man gud ko wala ko shit sakita na footsack kay di ganahan makita ang footsack ba sa heel, so wala na siya na ako isuot. Ayun, nagmamahay nga, may pagkadana lang ko at least para inig uli di sakit. Pero kunwari gud nagwalk nga wala ray sakit, pero sakit gud siya. So karon sanan ako sa bahay, nag-ilis ko kay igang dino, of course a corporate attire ta nga murag K-pop nga. It's nice man, it's very aesthetic, pero wala ang jud ko ka picture sayang. So yun, siguro mulaag ko later magkaraoke, pero nagano ko kinakagasto na magud kog 500 kahapon, tapos 500 na sad karon, supposed to be every week 500, diba? Pero sa diin na lang kay me time. Rason. Yeah, I will update you later. Ay, mag-update pa ba ako? Mataas na magod ni kinay audio later sa ako interview, so hindi na lang guro ko ma-update later. Pero maglaag ko karon. Magkaraoke ko sa email lang kay sakit kay kung tiil, di. Tapos mag-eat ko og something kay 1 month man kahapon na to, di ba? Ilang, bye-bye. Hi, di. Wala ko kahibaw mong good di nga exam nila karon. Nag-note si Ace mga exam nila karon, di ay. I didn't know, and I don't have any way of knowing it man pod, so I don't really know. I have no idea at all. Wait lang. That is why, diba supposed to be, if they have exams, I would be there, pero kay wala lagi ko kahibaw niya. Di ba di ka plano ko kanina nga saba sa namang gabaklay ko ron sa road kay later I will tell you. Wait lang. So supposed to be after sa interview kay maglaag ko, pero kay under the weather ako ang feet tungod sa heels, so wala siya totally na canceled, postponed lang kay magkuan man sad may mag-catch up mi nilay kay next Sunday. Wait lang, mag-catch up ni inig Sunday kay busy siya sa weekdays. So weekends ra siya okay, pero Sunday ra sad niya, which is church day man, so magdungan na lang migsimba. Saba. So yun, tapos after nagchika man mi sa messenger, kadayo trabod like mga 3 to 5 minutes lang. Tapos so basically after sa church ay after sa misa kay maglaag mi, tapos chika tas mauto pag after na mo chika sa messenger kay nakita na ko ang notes ni Ace nga supposed to be daw kay 1 hour and 30 minutes supposed to be daw 1 hour and 30 minutes ang ilang duration sa exam, pero na daw changes. So sunada sila exam karon. I didn't know, pero nagsuspect na ko daan nga nasa exam karon. Wala lang kanang lang intuition lang. Tas ayun, pagkaibaw na ko kay yun nga sa baba. Tapos mo to pagkaibaw na ko adto kay ano ko lang wala naman ko mabuhat kay man naman ilang exam. Tapos sa binge watch ra ba jud og anime kay wa ko mabuhat. Pero taod-taod kay nitindog ko tapos nag-ilis kay managkot ko unta supposed to be kay wala man ko ka-pray niya for like a good luck para sa iya exam. So karon na lang karon na lang mag-pray na lang ko para like at least ang result is good ganyan. Pero pag adto na ako sa San Vicente di kay kuan bitaw na kanang sa term ano ay walay kandila di. Ang ilang dagkatanan is walay kandila so mao to ni-try ko open man ang church so ano ko basin pwede ra tanisud ko sa church tas dito na lang ko nag-pray. Yawa po siya tao di ay nakay ka ng mga kinabitaw mga acolytes nga magstay sa simbahan nga pero sila ra nga niya tapos so ako ray tao dito di galohod-lohod. Pero nag-pray bitaw ko dito at least kay di man ko kapanagkot, 'di ba? Tinga si Iwin nga nung mulakaw ko ba nga. Naman si Iwin niya. Tinga siya nga nung naglakaw-lakaw ko. Pero yan, abot na ko sa balay, man ako pray. So ang ako ang katong pangkandila ako na lang gihug sa katong donation box. Intag pasara siya di. Sige di ay, sud ako sa balay di, bye-bye.
Yes, what's your family name? Okay, Miss Cabande, tell me more about yourself.
So good morning, ma'am. I am Erlinda Ita Batinde. I am 21 years old. Originally from Lowy Osog, Cebu po. And then
You're from where?
Lowy Osog, Cebu.
Cebu?
Yes.
Mm.
Well, to visit there, ma'am, there's a lot of beaches.
Right.
We also have our Sliman Island po. It's very, a mini island located at the Sliman po. It's ours. So, yes. I haven't been there, but because right now I love to wander around.
From Oslo to Sumilon, how many hours?
No, it doesn't take you an hour. Perhaps 5 minutes.
By boat?
By boat.
So near. I'm very much interested. Okay. Tell me more about yourself, Miss Cabande.
So, currently residing at Arcali Street, Cebu City po. And then, I am a newly licensed graduate. I have a lot of experiences in pediatrics, geriatric, medical surgical ward, as well as psychiatric po, and ORDR.
Okay. Miss Cabande, what inspired you to pursue a career in nursing?
So, basically before, I don't really want to be a nurse at first because I wanted to be a teacher. Basically dreams. But then I hear this, it's always been the reason why I took nursing now because I hear this radio news about a grandma and her granddaughter that has been neglected because they don't have money for and the granddaughter dies. That was way back when I was in my grade 3 class, so it's really pushing me through. And then when I graduated senior high school, I almost gave up the nursing course because we don't have the money yet, and my sister is still studying college. So I took BS Math in other school, and I passed, of course. But then my family knew that I wanted to be a nurse. So my brother, who is now a seaman, is the one who's supporting me. He pushed me through like, why did you took this one? You said you wanted this one, and then I said, no, I will sacrifice this first, and then I will pursue it later on. But then he said, no, you have to take the opportunity right now, as long as I am.
Okay, that's good. Okay, Miss Cabande, what are your strengths and weaknesses as a nurse?
So, long before, I believe that I have these strengths, plenty of them, and one of the most that stuck to me is that my communication skills with my patients, and then with my healthcare team as well. I believe that it fosters teamwork with my healthcare.
Okay.
And when we talk about weaknesses, I tend to work a lot on my own. That's why when I became a leader like mga tasks, I hesitate to delegate tasks because I thought that I'm not doing enough po. That's why. But I believe naman po that it fosters teamwork po with my team.
Okay, another. how do you prioritize care for multiple patients with different needs? How do you prioritize care for multiple patients with different needs?
Okay, so we have been taught po since first year po about the importance po of prioritizing problems with the patient po. And one of those ways is the ABC triad po. It talks about the airway, breathing, and circulation of the patient. Which one of those needs the prioritization the most is the one with the airway problems, then next to the breathing and circulation.
Okay, alright. Ms. Cabande, describe to me a challenging situation during your clinicals and how you handled it.
So one of the most most memorable experience I had during my training was that I have a multiple po from the geriatric and back to the medical surgical ward. And one that still stuck with me was that there was this patient who got agitated po because he wanted to refuse this medication. It's very important medication, but he wanted to refuse to take the medication po. Therefore, I was tasked to de-escalate the situation po. And then doing that, of course, at first I got scared because the patient was agitated and confused. But I listened to the patient po, validated her feelings, and then told her and educated her po about the importance of medication adherence po.
Okay, alright. Ms. Cabande, okay, how do you ensure medication safety and accurate administration?
Okay, so it's basic principle for nurses to adhere with the 10 rights of drug administration po. You have to, if not double, at least triple or how many times you want to double check the labels of the drugs, the right drug, the right patient, all of the list what's the right of administration.
Okay, alright. Can you share to me an example how you demonstrated empathy to the patient or their family?
So there is this time when I was on my geriatric rotation. So we have this patient, emergency amputation po because there is an infection with the feet po sa patient po. And the grandchildren was there. The grandchildren, it's a 68 years old woman po. And then, of course, you know the feelings of sadness in them. So I tend to put myself in their shoes po because I have been there as well. I just had my grandmas and then lost them. So I feel empathy with them by putting myself in their situation.
Pwede na. Okay na. Okay. Naganda ang interview daw sa among transcript. Salamat kayo. Okay. Another, Ms. Cabande, how would you deal with a language barrier with the patient?
Because it's very common for in the hospital, and of course I have been trying to get ready with it because I'm trying to work abroad and like that. So of course the most basic way to deal with language barrier is to make sure if there is a medical interpreter in the hospital. If not, then try to at least use simple terms for the patient to understand. And another is the use of visual aids from there.
Alright, okay. Describe to me a time when you helped a colleague during a challenging situation. Describe to me a time when you helped a colleague during a challenging situation.
Okay, so I have this close friend of mine during my training, and then he administered a wrong medication po. So yes, it's very at first he didn't tell anyone, and then approaches because we're close friends po. So he told me that he administered the wrong medication to a wrong patient po. So basically I told him that you have to take accountability about it. You have to tell the doctor and ensure patient safety at first.
That medication is for what?
It's what they call that, it's Ceftra po, Ceftriaxone, so tapos, they call it, na maliit na patient.
Okay.
Yeah, tapos, pero di ko na-release ka na i-pack na sa...
Alright. What was the reaction of the patient? The status? The
The patient status was good naman isa. Ano ba ito? Pag first mistake, I'm sure the patient is okay. I told him, yes, we are approach the doctor.
That's good. That's very important. Okay. What does patient cared mean to you? What does patient cared mean to you?
So patient care means to
A patient-centered care, I think. Patient-centered care.
When we say about patient-centered care, it's all about the patient's holistic well-being po. The care of patients' social, emotional, and mental well-being po. Not just the absence of diseases, but as well as the overall well-being of the patient po. And then it includes, that's it.
Okay. Miss Cabanillo, where do you see yourself in 5 years?
So, it's always been a very nice, a refreshing question to me every time it's asked for me, like, where do I see myself 5 years from now? And I think I can see myself to a institution that values me very well, and it makes me like a very competent nurse na po, handling patients well, and then living her life for the fullest.
Okay. Alright. Miss Cabanillo. Okay, my next question is, let's try to imagine this is St. Luke's Medical Center, St. Luke's Hospital. Why do you want to work here?
Okay, so I admire the hospital's commitment to patient-centered care and continuous professional development po. And then I heard about its innovative programs that fosters working culture as well that aligns with my values as a nurse po. That is why I am eager to apply my skills and knowledge and contribute to this meaningful hospital.
Okay. Miss Cabanillo, I have here a sample scenario. Scenario number 1. A patient with diabetes is refusing to take their medication. How would you approach this situation?
Okay, so it's very important to take note about medication refusal with the patient. So of course, Miss, before you don't have to force the patient, of course, because it's their right. But you have to at least educate them what the effects of refusal of the medication is and how important the medication should be to the patient.
Okay. Another. Miss Cabanillo, during the code blue, the team member is panicking and not performing their role effectively. How would you handle this while ensuring patient care is not compromised?
Okay. First and foremost is I will confront po the colleague po in a calm way po. Calming himself po as well, telling him that this is a crucial part of the patient's life. Therefore, we have to be at least we should be what we call that attentive po, and then cheering him up na we can do this. And if he's not really into it, then we will just work out.
Alright, okay. Another. You notice a patient with dementia becoming agitated and refusing care. What steps would you take to calm them down and address their needs?
Okay, so first is I will talk to them po calmly and then allowing them po to verbalize their feelings, and as me as a nurse, I will validate the feelings po and then make sure that the patient is safe. Of course, that's the priority here po. And then after the calming is I will talk to the patient po na naman to verbalize more about it.
Okay, alright. Another Miss Cabanillo. During the shift handover, okay, the outgoing nurse fails to provide complete information about a patient's medication. How would you address this situation? During the shift handover or the endorsement, the outgoing nurse fails to provide complete information about the patient's medication. How would you address this situation?
Okay, there's a lot of ways to address that situation po. First is to confront the healthcare provider po, making sure that the order is correct. And if the healthcare provider is not there, then try to visit the pharmacy po, the hospital pharmacy. Perhaps it has been delivered there, so there's information. And if not, try to consult with the patient itself po, kasi they know po about the drugs po.
Okay, alright. Another. You are working on a particularly busy shift and the workload feels overwhelming. How would you ensure patient care is not compromised?
Okay. So first things first is you have to calm down and then focus po. It's the main thing here. We have to focus and then start prioritizing the patient's problem based on your ABC or whatever is needed po. And then after that, we have to make sure that each individualized care is still intact po.
Alright, another. you are assigned a patient with chest pain. During your assessment, you notice the patient is sweating and has a rapid heart rate. What steps will you take to manage this situation?
Okay, first is to ask po about the pain scale of the patient. That it's very, like, for example, 6 to 10, it's very nasakit. So I will ask the healthcare provider to provide us a prescribed analgesic pain reliever po. And if it's not there yet, then I will teach about deep breathing exercises and any pain relieving.
Thanks.
Thanks so much.
Congratulations. You're hired. Okay.